Hello, and welcome to another beautiful episode of Softline. I'm Nancy Banigo, and with me today, not Edidiong, but I have my guest who is going to double up as my co-host today. Before my original co-host comes in, she's Dr. Mary Udoh. Hello, Doctor, you're welcome.
Hi, Nancy. Good day, viewers. Nice to have you.
Looking all pinkish.
Thank you. This is Pink October.
Pink October.
So from 1st of October to the last day in October, I am pinky.
Oh my goodness. That's nice. But why is it that we have to wear pink in October? I know we'll be discussing more of that. I wouldn't want us to let the cat out of the bag. So without touching that topic, can you tell us another reason why we should wear pink in October?
Pink October. Creating awareness.
Okay.
Pink is all about breast cancer.
Oh, she like the
soft touch.
Okay. Yeah. All right. Okay. So why is it so? Why should we wear pink for creating awareness in October?
The whole of the month of October is Pink October, like we've really said, is a whole month of creating awareness about breast cancer because this concerns us, concern the women, concern the people around us, the men around us, and everyone in our community should be interested in what happens to the breast. So the whole of this month, from the 1st till even the 31st of the month, talking about breast cancer, what it is, what about it, what can be done to curb the menace of breast cancer in our communities, and what can you do as a person?
All right. Let's not share everything now before we start the main discussion.
All right.
Okay, so I wanted to know, because, there is this argument where people say, is pink supposed to be for women? Why pink? Why not pick another color? We have peach, which is also soft. We have, other colors that are also soft. So do you know why pink was chosen?
Well, I wasn't there when it was chosen. But, every time, like preparing for babies, pink for the ladies.
So you're one of them. You're one of them
for the males. So I feel because more women come down with breast cancer than men. So that's why the color pink was chosen. To make it soft, to make it pinky, to make it beautiful. That is not all about the gloom.
Okay. You know why I wanted to know why pink? Because once upon a time, there was a woman who came to, delivery and all that, and she was carrying mixed colors. She wasn't carrying pink. And then when she entered, I was there when the nurse accosted her and said, madam, now girl, you won't born, you can't carry different color. Why you not bring pink? I was like, even coming from a nurse, why? Why would you tell her to bring? He said, yes, now she knows she's giving birth to a girl. So why she carry see blue, see purple, see this one? Madam, why you not buy pink?
Wow.
So I was like, so people have made pink to be for girls.
Yes,
and then
blue, purple for other sides. But then there is unity in diversity.
Okay. I guess that's why she chose to, mix up the whole color. All right. Thank you so much, Dr. Udoh. We'll go on a very quick break, and then when we come back, we introduce our topic proper. I've already introduced my guest, but I'm going to tell you who she really is. I just mentioned her name as Dr. Udoh, but when we come back, I'll tell you who she really is and what we'll be discussing today. A very interesting topic, I must tell you. So stick around. We'll be right back after this short break. Thanks for tuning in. So today we are shining a light on breast cancer awareness, a topic that affects all of us and it's close to our hearts. So joining us, like I earlier introduced, our distinguished guest. Her name is Dr. Mary Udoh. She is the president of the Medical Women Association of Nigeria, Akwa Ibom State branch. So breast cancer awareness, Dr. Udoh. Here we are again.
Thank you. Thank you.
So we're going to start like this. I know breast cancer is not a new thing, but I know there has to be a problem why every year we take the whole month of October to try to create awareness around breast cancer. But before we delve into the main discussion, could you just give us those misconceptions people have when we talk about breast cancer?
When we talk about breast cancer, there are lots of misconceptions.
Okay.
There are lots of wrong things that people assume. And we see that people attribute breast cancer to so many things. Like a man asked, my wife has breast cancer. Can she eat with me? Can she lie down on the same bed with me? Now, breast cancer is not transmitted by shaking hands or eating with the person or lying down with the person or having fun with the person. And some people say, oh, they say it's spiritual. They say I should stay in the church. Well, there are so many misconceptions. Then some people say, oh, if you don't have exposure to your husband, you can come down with breast cancer. These are still wrong things. So, but for today, we are going to talk about what breast cancer is.
Okay.
What do we expect to see in our bodies? Those are the signs and symptoms of breast cancer. What causes breast cancer? Then, what can we do in areas of prevention? What can we do as women? What can we do as men? What can we do as communities to curb this menace of breast cancer? Because it's becoming like a wildfire in the communities. What can we do as policymakers? What can we do to curb the menace? So that's why we're here.
All right. So let's just kickstart.
Okay. So when we talk about breast cancer, I want to ask, breast cancer, what is it? So breast cancer is an abnormal growth on the breasts. The way God configured the body such that the body should grow from our nails, our hair, every part of the body should grow, but it should be controlled. That's why you don't grow forever. So for the breast tissues, it's configured to grow, but when there is an abnormal growth that is not limited to what it should be, presents as breast cancer, and it also has the propensity to invade other tissues or spread to other parts of the body.
All right, Dr. Udoh, just give me a minute. Let me just tell our listeners, our audience out there, if you would like to call the doctor to ask any question at all that has to do with breast cancer, our phone numbers are 0913-627-5484. And the second number is 0911-209-7653. Please do call and get that question clarified by the doctor today. All right, Dr. Udoh, go ahead.
Thank you very much. So having defined what breast cancer is, the next point is what causes breast cancer.
Okay.
Because if you know what's the cause of a thing, you do all you could to prevent it. Like, say, oh, I come down with malaria. I know it's mosquitoes that cause malaria, so I'll protect myself against malaria. But for breast cancer, the cause is unknown. From all the researches that have been done, there is no single thing that we can say, oh, this causes breast cancer. However, there are risk factors. Those things you see in yourself or around you in your environment that can predispose you to coming down with breast cancer.
Okay.
Number one is being a woman. It doesn't mean that men do not have breast cancer. Of course, men also have breasts, but the breast of men is rudimentary. So women come down with breast cancer. Like if you line up 8 women, 1 may come down with breast cancer in a lifetime. But for the men, if you line up 100 men, 1 can come down with breast cancer.
Quite rare.
So it is very rare in men, but it does occur. So being a woman predisposes one to having breast cancer. Then the next thing is age. As women grow older, they have the chances of having breast cancer more than younger women, though we are beginning to see more younger women coming down with breast cancer.
Oh, really?
Yeah. It could be maybe because of our exposures, the food we eat, the things we indulge in. So other predisposing factors are genetic factors, like family history. So if you have a mother, a sister, or an aunt that came down with breast cancer, you have a higher chance of having breast cancer than other women in the population. So it's genetic. Then another risk factor is that breast cancer occurs more in women that have never breastfed or that have never had children, nulliparous women. So women that have never delivered before have higher chances of having breast cancer than women that have delivered. Then also, breast cancer occurs more in women that have a long reproductive cycle, those that have the menarche, that have the menses earlier, we call it early menarche and late menopause. They begin to have the menses earlier, then it stays on and on till they have the menopause. That's the stage of menstruation at a longer date. That's long reproductive cycle. So these women come down with breast cancer more than women.
If you could just clear that point for us, starting menstruation early, how early is early?
Okay, like now, we see girls that begin to menstruate like 10 years old.
Okay.
Whereas before, girls start like 15 before their menses begin. And now we see women that continue having menses even up to 50 or 55 years. So they have long reproductive cycle because the genetics about breast cancer is about the female hormones, the estrogen, those hormones that make you a woman, a beautiful woman, a curvy woman. So those are the hormones too that are implicated in breast cancer. Okay. So those women that have longer reproductive cycle, having menses earlier, that's early menarche, and having their menopause at a later date, late menopause. So they come down with breast cancer more than other women. Okay. Then also, women that do not breastfeed their babies have a higher chances of having breast cancer. So that's why we encourage exclusive breastfeeding for 6 months and continue breastfeeding for 2 years. Yes, until the baby is 2 years. You stop breastfeeding. Yes.
Dr. Udoh.
Yes,
please. What is this one now? 2 years?
Exclusive breastfeeding for 6 months and
continuous breastfeeding for 2 years.
For 2 years. It protects the woman against breast cancer, as well as other cancers that are female related.
Really?
And it's practicable. Women are beginning to do it. But some women still find it difficult to breastfeed for 2 years.
Good to know.
Yeah.
All
so
right.
other risk factors for breast cancer is the food we eat. Those foods that are higher in carbohydrates, refined carbohydrates, or also food that are refined products, canned food, those ones are not healthy. So people that eat this are more predisposed to breast cancer than people that eat natural foods, fruits, vegetables, and drink lots of water. So those are the risk factors that can predispose women to breast cancer.
Wow, a whole lot of them.
Yeah.
A whole lot of them. And others sound familiar, except for that one you mentioned, breastfeeding for 2 years. Continuous breastfeeding for 2 years could help reduce the risk of having breast cancer.
Yeah.
Okay, so can you tell us how it is that you get to know you have breast cancer?
Beautiful. So I was coming to that. Signs and symptoms. The things you see in your body that can make you say, oh, it looks like breast cancer. It could be breast cancer. So first and foremost is a lump in the breasts. Some people call it stone. Some people it could be like the seed of rice. It could be like the seed of maize or millets, something that was not there. So a lump in the breast that is not painful. And that is why it could even stay longer than necessary, because many people respond to pain. If they have pain in any part of the body, they begin to seek care. But the lump in breast cancer is painless. So many women tend to ignore it. Some women say, it is not painful now. I'm not giving it food now. It's just there. So a lump in the breast could be an indication that is breast cancer. Another cardinal feature is that the other changes in the breast, like the skin of the breast changing color to dimpling.
Okay,
sometimes
like the picture we saw. Beautiful. If our director could just bring that picture back.
Yes, that picture we saw is called
the orange.
The like pure orange, like beautiful. It looks like an orange skin. The skin of an unripe orange, most cases. Look at that, the skin of that breast having some dimples. It means the lymph glands are supposed to drain those areas have been blocked by the growing things in the breast cancer. So that is why you have those dimpling there. The lymph drainage is poor, is altered there. Then you can see the nipple there being inverted. Instead of the nipple pointing outwards, there is an inversion of the nipple. It means something is drawing the nipple inside. So those are cardinal features of breast cancer. Then sometimes the skin of the breast can look like scaly, changes in the color, changes in the shape and size of the breast. So, and aside from the breast, there's some women that have the breast tissues in the armpits, the axilla. So those changes too can also occur in the axilla. So that is why when you touch your breast, you should also touch your axilla In case the armpit, yes. Touch your armpit in case there are lumps in the armpit. So aside from those things that are okay, another feature in the breast is a nipple discharge. Discharge from the nipple that could be watery, that could look like blood, that could look like pus. That's any form of discharge from the nipple calls for action. If a woman is not breastfeeding, there should be no discharge from the nipple of the breast. So if you notice any form of discharge, be it watery, bloody, or pussy, please go to the hospital for it to be examined to exclude breast cancer. So aside from those features that are limited to the breast, when we begin to have spread of the breast cancer, like I said, there is propensity for it to spread. We can begin to have challenges in other parts of the body, like if it extends to the lungs, a person can begin to have difficulty with breathing, can have cough, and in some cases, if it extends to the brain, a person can begin to have convulsions or loss of consciousness. Person goes into coma. If it extends to the bones, the person can begin to have shortage of blood, become excessively tired, and then can have bone pains. Then also, if it extends to other parts of the body, like the waist, some women can have waist pain, can have weight loss, can begin to have loss of appetite when it extends to other parts of the body. It becomes systemic and it can go to any part of the body. So those are the signs and symptoms we could see in people that come down with breast cancer.
A whole lot. Thank you so much, Dr. Udoh. Now let's push this a little bit to the opposites, the men. What role do you think men can play in advocating or creating awareness about breast cancer?
Beautiful. There are many roles men can play, because when a woman comes down with breast cancer, in most instances, it affects the whole family.
Yeah.
So as a husband of that woman, as a brother of that woman, as an uncle of that lady, as a friend of that lady, she needs support. She needs support to achieve care, to access care. Number one, for some women, it's even the husbands that discover the lumps in the breasts. Yes, the husband said, oh, this breast was not like this. I think I felt something. So the breast does not belong to the woman alone. Your partner has a stake in that breast that you carry. So the woman needs support. The woman needs encouragement. One, to access care, then two, to sustain care, and also continued support even after the woman has achieved cure or care. Then that's family support. We need the men as much as we need other family members.
All right. I know in the course of your work, you have seen a whole lot of cases of breast cancers. Let's just talk a little bit about survivors. Okay. Tell us some survival stories that you've seen.
Because, as we're talking about the signs and symptoms, we'll still talk about prevention, then care, management, treatment of breast cancer. I want to let us know that once you hear breast cancer, it doesn't mean death sentence, because that is the fear that make people to go to the wrong places, to do the wrong things. They say, oh, breast cancer, it means I'm gone. They begin to do the wrong things. So I want to emphasize that breast cancer is not a death sentence. We have women and men that have come down with breast cancer. They access care early and they are living. That is why we emphasize that early detection is a key to survival in breast cancer. We have lots and lots of women that are going about the normal businesses as survivors of breast cancer, and they are advocates, advocating for other people to access care early. So early detection is the key. And how do we detect breast cancer early? That's when we'll talk about breast self-examination. Breast self-examination. For you out there as a woman, you have to examine your breast once in a month. Once you get to reproductive age, have to examine your breast once in a month. And to examine your breast by yourself, it doesn't take anything. For a woman that is menstruating, immediately just after your menses, you examine your breast by yourself. Then for those women that have clocked menopause and are not having the monthly periods again, You can choose a day. It could be your birthday. Maybe your birthday is, say, 1st of October. So every 1st of the month, you examine your breast by yourself.
Okay.
And how do you examine your breast by yourself? You can stand by the mirror. One, you look at your breasts, look at the shape, look at the size, look, are there changes in that breast? Are there any changes, the color, the size, the contour of the breast? And you could do that by putting your 2 hands at the back of your head.
Okay.
Once you do that, it will lift up the breast tissues. The breast will stand and you can see well. So, and once you do that, you begin to divide the breast into 4 parts. An imaginary line from up, down, then across.
Okay.
Once you do the imaginary line, the breast is divided into 4 parts, and each of those parts is a quadrant. Then you use the palm, the pulp of your 4 fingers. You use your right hand to examine your left breast. The pulp of your fingers, not the tips. You don't poke the breast with the tips of your fingers.
Okay.
So you use the pulp of those 4 fingers. Then you place gently on the first part closest to your chest wall, the right side. You rock it gently as if you are rocking a doll. And as you are rocking, you are listening. Are there things moving in between your fingers, like seeds? Is anything changes there? Then you go to the next quadrant. You rock gently as you are rocking on the breast. You are listening. Are there seeds moving in between those fingers? You go to the next quadrant. You roll gently and rock on the chest wall. If there is a lump, you will feel it rocking those fingers. Then you go to the last quadrant and also rock it. Then you don't forget the armpit. You also rock the armpit. Then when you are done with rocking with the pulp of your fingers, you use your 2 fingers and go to the nipple. Remember, one of the features we said is a nipple discharge. You press the nipples in between the fingers to see whether there is any discharge. And once you are done with that, you use the left hand to examine the right breast. So you use the right hand to examine the left breast and the left hand to examine the right breast. So every woman should do that every month. And she asks for the role of men. Remind your wife, darling, have you examined your breast this month? Ask your sister, sister, have you examined your breast this month? It is very important. So aside from that, there is what is called clinical breast examination, where a person walks to the healthcare facility and the healthcare worker examines the breasts. So every woman should do at least 1 clinical breast examination in a year. Your fingers or palms may not be able to pick the lump, but if you walk to the hospital, the healthcare worker will examine your breast and tell you the status of your breast. And if anything is discovered, you can be pointed to care early, because early detection is a key to survival in breast cancer. So now we are talking about the prevention of breast cancer. I've talked about breast self-examination. I've talked about clinical breast examination. There's another investigation that's called mammography, where a woman goes to, where a woman that's over 40 years, especially those women with history of breast cancer in their families, should have access to a mammogram. A mammogram will pick up any tissue, anything in the breast that looks like a lump, no matter how tiny it is. So your healthcare provider will direct you on how to access a mammogram. So aside from those ones being the prevention of breast cancer, our diets, the things we eat. So we encourage you, please eat more of fruits and vegetables and drink lots and lots of water. Instead of going for refined carbohydrates that are high in sugar content, please do the natural things. God has so blessed us in this environment with natural foodstuff, natural fruits, natural vegetables, especially those ones that are in season. Please get them. have them handy in your home. Aside from your other family members can have access to this, and it will help prevent a lot, aside from breast cancer, other chronic medical conditions like hypertension and diabetes.
All right. Thank you so much, Dr. Udoh. Let's go on a very quick break, and when we come back, we'll continue with the discussion. Stay with us. Thanks for being there. So we've been doing, Dr. Udoh has been doing justice to this breast cancer discussion, trying to create awareness around breast cancer. But before we go ahead, let's take some few tweets. We'll have our first tweet here, and it says, do you know that men can get breast cancer? I'm sure lots of people are surprised about this particular one. While rare, men should also look out for symptoms like lumps, nipple discharge, or changes in skin texture. Early detection saves life. Now, how come you can't get breast cancer if you are breastfeeding a smoker? I don't understand that question, Doctor. Do you understand?
I don't really understand it too.
Okay, so our last tweet here is from Farmer Oluoma, and she says, two reasons to talk about breast cancer today. It is the second most diagnosed form of cancer. Okay, it is Breast Cancer Awareness Month, of course, October. Although a major cause of cancer death, breast cancer can be successfully treated if detected on time. Yeah. Okay, and so that's all for the tweets we have. Okay, so Dr. Udoh, I see you have a whole lineup of lectures to give to us today. So what's next in line?
Okay, thank you. It's welcome. Breast cancer awareness because it's very touchy when I see women come down with advanced breast cancer because they did not access care. Some of them did not have any information whatsoever. So every opportunity we have to dissect it and talk about it. So we're talking about prevention of breast cancer. Like I mentioned earlier, that women that breastfeed their babies have lower chances of having breast cancer. So we encourage exclusive breastfeeding for 6 months and continued breastfeeding for 2 years. We talk about our diet, then exposure to radiation. Please, if you don't have any business doing an X-ray, doing something that exposes you to radiation, don't just walk down to a diagnostic center and say, I have chest pain, I want to do X-ray. No. Because exposure to radiation can predispose you to breast cancer. So you only go for any form of X-ray or radiation when a doctor or a healthcare worker diagnoses or request it for you to do it. You do not just do it exposing yourself. Then we've also talked about women that have the family line of breast cancer. Your mom, your aunt, your sister had breast cancer. Please don't wait until you have it. Go for those clinical breast examination. It will go a long way in helping you. So having talked about the signs and symptoms, then the prevention, we now go into management of breast cancer. Like we said earlier, early detection is the key to cure. And we have many that have come down with breast cancer. They are treated, they are free, and they're going about doing their beautiful works. So there are different options to care depending on the stage of the the staging of the breast cancer. There are treatments that could be like chemotherapy, where medications are given to the patient. We also have women that are exposed to radiation that can target the breasts, the tissues of the breast cancer. Then we also have other modalities of treatments like mastectomy, where the diseased breast is cut off. And we also have challenges here, where a woman will say, oh, I don't want my breast to be cut off, let it be there. And most times I ask, what are you doing with a sick breast? And we even had a situation where the man says, oh, I wouldn't accept my wife's breast to be cut off. I enjoy the breast. But you know, the thing that happened, in a short while, that woman died with the breast. And that woman went and married another woman and continued enjoying the breast. So women, your breast, decision about your breast. If you come down with breast cancer and the option is for the breast to be cut off, that's mastectomy, please give consent and let the sick breast be cut off so you can live and have those beautiful dreams of yours come out. So the radiotherapy, where radiation is targeting the tissues of the cancer cells. So there are different forms of therapy for breast cancer. And once this treatment is accessed early, the woman has a higher chance of survival.
Okay. Now you say you made mention of different treatments
modalities
for breast cancer.
Yes.
Do we have any latest research? Any latest technology in the treatment of breast cancer?
Oh yeah, the latest technologies now are those ones that help in early diagnosis and treatment. Will target those radiation targeted directly on those tissues of the breast cancer, and these are most times AI directed. Invasive things that can bring out the fine line, because those other earlier treatment modalities, the older ones, as it's targeting the cancer cells, also targeting the normal cells of the body. That's why a woman will come down with all the hairs being lost, or comes down with tissues being damaged, the nails, the hair, even most tissues are also damaged. And with time, that's why like chemotherapy, it's pulsated. A woman will do it, go back, get some recovery of the normal tissues, then comes back. But the newer technologies are coming down with those treatments that target those breast cancer, the cancer tissues alone, and sparing the normal tissues of the body.
And how popular is this treatment? Do we have them accessible? They're accessible here in Nigeria or in Akwa Ibom State?
Here in Akwa Ibom State, no. But I believe with them, the upcoming things in the healthcare sector, the innovations that are coming up, we believe those things will come here. But out there, people are having access to care and cure in ways that are easier, that do not damage other cells of the body, but target the cancer cells.
All right, let's talk about why people really do not like to go get their breasts checked. Have you seen reasons? Have women talked to you why they don't like to come out for breast cancer?
Most women do not even know that their breasts need to be examined. Most women don't even know. It's ignorance in the first place. Ignorance about the issue that there could be changes in the breast that could culminate in breast cancer. And some people attribute it to the general carelessness about people not being conscious of their health. We see many people being conscious about their looks. What should I wear? The kind of shoes, the kind of clothes to wear, but they don't pay attention to their health. So it's the general carelessness or ignorance of people about their health. And sometimes too, we see situations where someone comes down with a breast lump and diagnosed of breast cancer. Instead of accessing care, a person would prefer to go and stay in the church, say, okay, the prophecy said this, the prophecy said that, and I should not have surgery, the knife should not come on my skin. So ignorance that are perpetuated by wrong things about religion. So people getting wrong information in the wrong places. So it makes them to stay with the lump and present in the hospital in very advanced stage. I had a very sober reflection about 2 weeks ago. We happened to see a young lady of about 31 years. I presented with a breast mass that is as big as a newborn baby on one side of the breast. And she had been carrying that. So I asked her what happened. And she said, okay, I went to the hospital, but the final point was she was in the church. After going to the hospital, diagnosis was made and care was rolled out. She even had about 2 sessions of chemotherapy. But she went back to the church and said, oh, I felt unwell with the chemotherapy. And so I was advised to go seek care in the church. And when she came back, when the lump actually burst and she was bleeding from the breast lump, and by the time we saw her, she was already paper white. So I advised her, please go back to the hospital and continue care. Diagnosis has been made and you have the diagnosis with you. The histologic diagnosis has been made, and she was really dying. I asked her, but you've been told what is wrong with you. She said, I have a lump in the breast. I said, but your diagnosis here says that this lump is breast cancer. She said, no, it's a lump. So this the point of somebody staying in denial because of what the person has heard. Maybe my prophet said this. My prophet said it is not my portion. And person will keep saying it's not my portion. Unfortunately, she died.
Oh, no.
Last week, she died. She died because she refused to continue her care in the hospital. Rather, went and stayed in the church.
That's so unfortunate. So unfortunate. Now let's talk about things your association, the Association of Women.
So the Medical Women's Association of Nigeria, Akwa Ibom State, is a non-governmental and non-profit organization of female medical doctors and dentists, So our passion is for the health of the women and children, and in extension, the men, the whole community, the whole family. So far, Medical Women's Association of Nigeria runs a well woman clinic where women come, they are seen by medical experts that are women, so they can share their intimacy problems in the breast, problems about the cervix, problems about the whole body. And we do clinical breast examination to screen for breast cancer. We also do cervical cancer screening by doing VIA, that's vitreous inspection of the cervix using acetic acid. Okay. Then we also do pap smears for the women. And we've been able to capture lots of women with early stages of breast cancer and also cervical cancer. So every third Tuesday of the month, the Medical Women's Association of Nigeria, Akwa Ibom State branch, sees women in the Well Women, Doctor, clinic.
We'll have to cut you short on that. We have a caller from Abuja. Idore from Abuja. Hello, Idore.
Hello. Good afternoon, Softline.
Good afternoon. You're welcome to the show, Idore.
Thank you. All right, so I enjoyed the good job you're doing, Softline. And this topic is really a topic I doubt if we will be able to get over. But my question to our guest.
Okay, go ahead.
Does cancer have a cure? Breast cancer. Does it have a cure?
Does breast cancer have a cure?
Yes, of course. Breast cancer has cure if it is detected early. We have survivors. They're walking about in the communities, they're champions, and they're advocates for breast cancer, encouraging other people to access care early. Like we said, early detection is a key to survival in breast cancer. So breast cancer is not death sentence. No. If the patient presents in the hospital early, there are different modalities of treatment that will culminate in cure, and they go about the normal duties.
All right. Thank you so much, Doctor.
I have someone. Okay. Please, can I still ask one question?
Okay, go ahead, please. Go ahead.
Okay. I have someone very close to me that died of breast cancer. Now, it got up to a point they told that they were going to take off the part of the breast that was affected by cancer. She was scared. She said she couldn't stand it, living with just one breast. Before the thing now spread all over her body, and right there, it couldn't be tamed anymore. That's why I'm saying, how do we let women know that at that point, if it can't be gotten early because you go about your life, like you said, most of us, we will not want you. We will just feel that affect our body, we've touched our breast, and we know how to go about it and do the right way, and there is no lump. Who will want to go to the hospital monthly? We don't like these things, except it's really spoken enough. So what I'm saying is, how do we get to talk to women going through these cases, and should we get to that point? Because this was someone very close, and she didn't want one side of her breast to be off. She said she will fight it till the end.
Okay, that's why we're here. How do we get the women to know that there is breast cancer? We take this information to the markets, to the churches, to the mosque, anywhere people are in the communities. We go to the interland, the villages. Okay. That's one of the work of Medical Women's Association of Nigeria, Akwa Ibom State branch. We go everywhere spreading this information. Next, we will be going to a community in Mbo, a Fiat community. We are going there to screen women, give them the health information, then screen women for breast cancer and cervical cancer. We go to the markets, we go to the churches, we go to the mosque, we go everywhere where people are, spreading this information. And you can be an advocate, have sisters, women around you. Please tell them what you hear about breast cancer. And you don't have to go to the hospital every month for your breast to be examined. We've taught women how to examine their breasts by themselves. Breast self-examination is done by the woman in her home, in the comfort of her bedroom. Inside her home. You don't need to go to the hospital every month. We said once in a year for clinical breast examination.
All right.
But for breast self-examination, once in a month by the woman herself in the comfort of her home.
All right. Thank you so much. I hope. Oh,
thank you very much.
All right.
Thank you.
Thank you so much for calling in, Igor.
All right. Bye.
All right, so doctor, when you mentioned your outreach in the going for the communities and all that, when you do this, first of all, is it done nationwide or is it just here in Akwa Ibom, your Medical Women Association?
The Medical Women's Association of Nigeria is all over the nation. Actually, every state of the federation has Medical Women's Association. And it is an offshoot of the Medical Women's International Association. It's a global body.
I mean, the outreach.
Yes, the outreaches. Yes. Okay. For us in Akwa Ibom, our concern is our people in Akwa Ibom.
Okay.
We have medical women in other states. Cross River, they're there. And they're doing their good work. If you look at this Pink October, there are lots and lots of activities going on in different states of the federation.
All right. So when you do some of these diagnoses, when you talk to these women, do you leave them there? Because I know some of them would say the cost of accessing medical care, it's something else. So when you do this diagnosis in these centers, what's the next step? How do you take these women along? How do you treat them? Do you just diagnose and then allow them be by themselves, or you do something else for them?
That is one of our core mandates. Once we see women with a breast lump or suspicions of cervical cancer, we ensure that we link them to access to care.
Okay.
So, and we know any cancer treatment is exorbitant. And Medical Women's Association of Nigeria has been supporting the women that are diagnosed with breast cancer to access care, because it is exorbitant. That's why we look for collaborations, we look for partners that assist us to do this work, because we cannot do it alone. So we encourage them to access care, and we link them to care facilities where they can, hospitals that they can access care. And we also support them in ways we could, because we know most of the people that even come down with breast cancer are very poor. They're pauperized, and it drains the whole resources of the family. Some of them go to sell their properties to access care. And we also discover that most insurance do not cover breast cancer, and because of the exorbitant nature of the cost. But we also have philanthropists, we have people out there that can lend helping hands. So Medical Women's Association of Nigeria, Akwa Ibom State branch, supports cancer patients with the little way we could. So that's why we look for collaborations, we look for support, look for partnerships, so we can help more people out there to achieve cure of breast cancer.
All right. Thank you so much, Dr. Udoh. You really said a whole lot and educated us today on breast cancer awareness. But is there something new? Tell us something, when you go out there to talk to women, all these women, what are the major complaints they give to you while they don't want you? Because from the caller we had, she said the sister didn't want her breast to be taken off. Some don't want their breast to be seen and all that. So what kind of assurance do you give to these women to make them come forward?
Yes, for those ones that present in the hospital, like end up having mastectomy where the breast is cut, there are things that could still be worn that makes the woman look good. Makes the woman look good. The diseased breast is gone, and there are things that have been prepared, that silicone that the woman wears on and goes about, and nobody will know that the breast was cut off.
Oh, really?
Yes, nobody will know.
How about taking because someone will say, why would you be working, if you can't afford the silicone, why would you walk about with one breast? And would you suggest taking out the two breasts?
No, not really. If the other breast is not diseased, there's no business taking it off.
Okay.
Once the diseased one is taken off, there are things that some women even put breast pad,
okay,
and they still have that beautiful look. You know, the psychological trauma could be there, or the consciousness, my breast is not there. That's why we need the support. Family members, partners, people in the community, the woman needs that support, needs that assurance. And that's why we're really talking about that every woman is unique in her own journey of breast cancer. So that unique thing that woman needs, once is able to talk to the counselor, she'll guide, she'll direct, and once the woman has that counseling, she'll begin to see her new life, living with breast cancer, living with the cure, the care at hand, the things she needs to do, her physical body, taking care of her body, her new body, how she can appreciate God that has preserved her. Those are the things that we keep talking and saying to the survivors so they can go about their normal businesses without the breasts.
Thank you so much, Dr. Mary Udoh. She's the President, Medical Women Association of Nigeria, Akwa Ibom State branch. Would you want to give some word of advice to women there who are struggling, who have seen this lump in their breast, what they should do? And those who do not like to do those self-examination, how important it is to women?
My take for you, this Pink October, you, that woman out there, have you examined your breasts yet this month? If not so, please go ahead. Go to the nearest convenience and examine your breasts. Don't allow this opportunity to pass you. And every month, make sure you do that. If you notice something in your breast, please go to the hospital. Don't go to the wrong place. If you notice any change in your breast, go to the hospital where your breast can be examined and you be shown the proper thing to do. Then for those that are living with breast cancer, there is hope for you. Do the proper thing. Oh, don't feel it is all about you. There are many other people that are passing through the same challenge. So do the proper thing that you've been told. Instead of going to stay in the church to waste your life away, go to the hospital. And through that hospital, you can be linked to maybe an NGO or a philanthropist that can help you. There is help for you. Don't just stay and die in silence. For the family members, for the spouse, the communities, the policymakers, we all have roles to play to curb this menace of breast cancer. It's not about that woman alone. It is about all of us. Let's all play our role to make that woman survive.
All right.
Thank you.
Thank you so much, Doctor. Nice having you on air today. And then I just remembered, somebody told me about the predicament, hair loss after going through the chemotherapy and all that. She's now suffering from hair loss, so she has to be wearing wigs every day. So if you could just give us some words of hope.
Oh, you, that beautiful lady out there, you underwent chemotherapy and you lost your hair will grow again.
It will grow, right?
Yes.
Okay.
Remember Samson? His hair grew back.
Oh.
So you'll come back. I've had many women undergo chemotherapy. The hair went even up to the lashes and the eyelashes, the eyebrow, hair on every part of the body. But eventually the hair grew again.
Right.
So that period of time that the hair is gone, you can make use of your wig and still look good. You can draw a line, a beautiful one, where you have the brow and still look good. It's just a matter of time.
Absolutely.
Your hair will grow back.
Thank you so much.
Those beautiful nails will come back. Those beautiful parts of your body, they'll come back again. Just give it time.
All right.
It will go back.
Thank you so much, Doctor. All right. Thank you so much, our wonderful viewers, for watching and participating in today's show. We really appreciate the call and the messages we received. Thank you to our special guest, Dr. Mary Udoh, for sharing her valuable insight on breast cancer awareness. So stay safe, stay informed, and we'll catch you again in the next episode. From me and my guests, bye-bye, and thanks for watching.
Bye.